Middlemore Hospital's leaky and rotting buildings will be given an $80 million facelift, something the government says has been needed but neglected for years. The Prime Minister Jacinda Ardern and Health Minister David Clark announced the funding boost at the South Auckland Hospital this morning. Eva Corlett filed this report.
It was the first time the Prime Minister had visited the hospital during her leadership. She was welcomed with a pōwhiri and joined by official representatives from both government and the county's Manukau DHB. Hospital staff filmed from their phones as Ms Ardern made the announcement.
We are here to share that we will be investing more than $80 million in 4 projects at Middlemore and the Manukau Super Clinic site.
Ms Ardern says improving the state of hospitals is a government priority after what she describes as years of neglect and underinvestment during the previous government. The money will go towards upgrading leaky buildings and earthquake-prone facilities at both Manukau Super Clinic and Middlemore Hospital and resolving issues with rot and mould.
I see this health and well-being, our physical and mental health, as being at the centre of what we need to do as a government. And we can't deliver that without the bricks and mortar being in good shape. It detracts from the job that you do. It makes it harder if you don't have the facilities that you need and the infrastructure that you need.
She spoke highly of the work done by hospital staff despite the state of their facilities. The Health Minister, David Clark, says 4 main projects will also benefit. Those include recladding the Kids First building, relocating the radiology department and establishing a radiology hub and upgrading services at the Super Clinic.
These projects will significantly improve the standard of key facilities. They will also help position County's Manukau DHB to better handle a growing population with complex needs.
Mr Clark says the project will require careful planning to minimise disruption to staff and patients. Some of the funding will go towards assessment costs. Neither Mr Clark nor Ms Ardern could confirm exactly how much, but they say a substantial amount will go towards actual fix-up costs. County's Manukau DHB has previously estimated that remediating Middlemore's problems would cost about $1.6 billion. The coalition government has also pumped money into other Auckland hospitals' infrastructure. Auckland Hospital has received over 3 times what Middlemore is getting, and North Shore $200 million. But the chair of the county's Manukau DHB, Vui Mark Goshi, isn't bitter.
We've worked together across the 4 Northern Region DHBs, so look at this as a package for the whole region because we shift people across boundaries. Whatever's spent in the region helps the whole lot of us.
Andy Hipkiss from the nurses' organisation says $80 million is a small step on a long road. He says the hospital has been deteriorating for years and needs significant investment, but that staff and patients will benefit from this.
You can't put poorly children and the nurses that look after them in a mouldy building where they're potentially going to pick up more diseases, more infections. It has to be clean, it has to be safe, and it has to be absolutely fit for purpose.
The government is uncertain how long it will take before the upgrade is complete, but Mr Hipkiss is urging it to get repairs underway as soon as possible. Mr Clark says Treasury estimates around $14 billion will need to be spent upgrading medical facilities around the country over the next 10 years. I tāmaki mokoro mō te hotak o te ahiahi nei, ko Eva Corlett tēnei.